All right, guys, welcome back to the Progressive Rehab and Strength Podcast. I'm your host, Dr. Rori, head clinical coach here at Progressive Rehab and Strength. And today I am recording a podcast with my lovely husband, father of my beautiful children, and also a physical therapist here at Progressive Rehab and Strength, and a strength coach, powerlifting coach, all of the wonderful things here at PRS, and professor at Adelphi University in exercise science. And he's also a dad, just like I am a mom. And our podcast hiatus was because I was pregnant and we had a second child. And she's great. She's beautiful. She's so different than our son. And we are definitely not getting as much sleep as we did with our sleep through the night from 10 weeks on son. Now we have a 4-year-old who wakes up and comes and gets us in the middle of the night to use the bathroom. And we have a 7-month-old who still wakes up 1 to 2 times a night. So, and 2 crazy dogs who think that they own the house and, jump in bed with us, get sick in the middle of the night, knock on the door to go into the room with the baby sleeping. Like, it's just crazy. With all that said, it's hard to have energy to train. And most people, as they age, get married, have kids, their life changes, they get a new job, they have other responsibilities, and it changes the way we are able to continue to barbell train, strength train, and maintain our training habits. Definitely can influence that. So, this series that I'm doing with John on the podcast is going to be a series of 3 episodes where we're going to talk about becoming a new parent, mainly from the dad perspective, because it is definitely very different from my perspective in this relationship as a breastfeeding mother who also has some other health issues. It's definitely a different experience in terms of getting back into training or maintaining training habits. So, we're going to talk about it from the healthy dad partner perspective who doesn't have to breastfeed in the middle of the night. So, the 3 episodes that we're going to be doing are going to cover managing your training expectations after having a child come into the family. We're going to talk about strategies to train in a time efficient manner, because when your life it's not your own anymore once you have kids. And then we're going to talk about developing training and nutrition habits in a chaotic environment. So, with that all said, John, welcome back to the podcast. um, so, can you talk to us a little bit about the differences in training and the situation surrounding training, and muscle development, recovery, etc., before and after having kids?
Well, I think you touched on, some of the things that are kind of obvious, right? When you were doing your introduction, sleep is going to be something that is compromised, right, to varying degrees. Obviously, everybody is different and has different situations and, arrangements with their partners in terms of how they handle that sort of thing. But like, you and I, initially, at least for, the first several months, I got up in the evenings with you, to change diapers and things like that, while you got kind of ready to breastfeed. So I was getting up, multiple times per night. Now I was getting back to sleep faster than you because you were, then in the chair with the baby and that sort of thing. But I was having certainly disrupted sleep and that sort of thing, and that has an impact on your recovery. And then there's just probably more so than anything, it's just kind of finding the time to train, right? And making the time to train. I think, the biggest thing for me from before kids is that, the only thing I had to really consider was maybe your schedule, right? And like, there wasn't anything stopping me from training outside of just like, my work schedule, and then, if we had something going on, socially or with family or whatever, right? So um there's just a lot more flexibility pre-kids than post-kids, right? After kids, you um you know, you really want to balance, obviously, taking care of yourself and doing things that are good for your health and that sort of thing, but obviously, you know, your child's well-being has to come first and foremost. So, you're working around that schedule, which is very different. And I think that that's probably the biggest thing. The number one reason that people don't train or exercise, in general, is they say they don't have enough time, right? So if that's the case for you before kids, and after kids, it's going to be, even
Worse.
tougher, right? Um, so I think that that's really where people struggle, is just like making the time or finding the time to train. Um, and I think something that I always stress to clients is, consistency is the most important thing, right? So when our kids were born, right off the bat, like that was something that for myself, I said, I'm not taking any time off from training. We got home from the hospital with JD and I trained like that next day, and um,
Even though that first night was like, what
yes.
happened?
Oh, yeah, it was terrible. I mean, I didn't have a good workout, but I trained, right? So, like, I actually remember I squatted and it felt like a weight that, I was squatting like in the low 400s that I've done for, sets of 8 in the past, just felt awful, right? It felt heavy, it felt slow, but I still trained, right? And that
Mhm.
was kind of the point, was to just immediately maintain the habit of training. And so that was something that was really important to me, was that I stay consistent, even though, I kind of understood that the training circumstances aren't going to be ideal, right? So your programming, it's not going to be what it was probably before kids. um, and you're going to have to make certain modifications in order to get your workouts in, but it can still be done, um, with, I think, some fine tuning of maybe expectations and programming and that sort of thing.
Mhm. Yeah, and I think that, you know, something is always better than nothing, and I say this. I have difficulty saying this to my clients, even though I say it to my clients, just because I feel like I'm almost a more rare case than the normal in terms of pregnancy and postpartum returning to training. But something is always better than nothing. So the fact that like you still went in and after JD was born, you went in, you did that workout, that was like setting the stage for what it was going to be like the rest of the time. But I do want to be fair to the people who don't really like have the time and resources to train. Or like you, it's very different actually. I mean, I think we can talk about this too. You're um before Maddie and after Maddie, because before Maddie, you were working so many more jobs. You were doing like so much more in terms of work. You know, you were working at the university, you were doing stuff for PRS, you were doing stuff for starting strength periodically, and you were working at another outpatient clinic, So and I think that that can play a role in it. Not that you ever missed training sessions, but
Hmm.
there are some people who like you missed a lot of time with JD. Like
Yeah.
you train on the weekends when he was awake or during his nap times, you didn't see him during the week cuz you were at work. But now you're not working in the evenings, but you're also not filling that time with training. So you're still actually training at the same times that you were training when you were working more, because you're spending more time with the children and with helping me, which should give me more resources to train, but I'm also breastfeeding, So we have to think of like, are you going to spend time with your children, or do you want to not spend time with your children and have someone else watch them so that you can train? It's like, where do you balance um this? And for you, John, it's like training at 5 o'clock in the morning or training at 10 o'clock at night, you know? not 10 o'clock at night. You might finish at 10 o'clock at night. Um, what, you look like you are thinking something.
Well, I mean, I think probably part of what helped me adjust was that I've always kept myself very busy. And like you said, I've always worked multiple jobs. And, um, my schedule prior to JD and even after he was born was, I'd work at the university during the day, and then I would go and see patients at the evening, several nights a
Mhm.
week at the PT office until like 9 p.m. So you're right, like I didn't have that time with him, like in the evenings and stuff like that. He would be in bed the majority of time when I would get home, and those sorts of things. Um, but that obviously wasn't really feasible to continue to do um, once Maddie was born. So, I adjusted my work schedule, but I'm still working multiple jobs, and I've always kept myself busy. So I've always managed to fit training in around a busy schedule, which I think
I think
was
that's what's
was
also
helpful.
I think that's also, like, very what's different between you and I, like, I am the kind of person who, like, needs space in my schedule, and needs that downtime for my mental health and my physical, like, well-being. Like, I just don't feel good, if I just don't stop. So for me, postpartum, it's been difficult because I've added more people to my family. There's more demand on my time. I get less personal time. Plus I'm breastfeeding, and my supply is very sensitive to my stress levels, my anxiety levels, my sleep. So like my lack of sleep, like my daughter our daughter's at daycare now, and if we have a bad night of sleep, like, and I don't take a nap, the output in a pumping session is going to be like 2 ounces less, which is significant for a baby that only eats 24 ounces a day, you know? So it I've always been the person who needs, like, the space and the calm, and you've always been the person who just, like, can't sit down. Like, it's to the point where, like, I'm like, "Dude, you do not have to fold laundry on a Saturday night. Like, you can sit down and watch a movie." And you're like, "No, I just gotta get it done." Like, so I think
Yep.
and we talk I think we're gonna talk about this in, the next episode, but a lot of it's personality. A lot of it's these foundations are set, like, before the baby, you know? So I think that if you're thinking about having kids and you are like already like you said before, if you're like already struggling to get workouts in when you don't have kids because you lack time or you lack um the ability to kind of like shift things around. Um, which is funny because you lack the ability to shift things around everywhere else except for training.
Oh, I
I
don't
mean,
I don't know about that. I don't know what you mean exactly by that, but
um, but if you're thinking about having kids and you're really worried about getting your workouts in after you have kids, like start setting that foundation for like where those workouts are going to come when you don't have time. And for
mhm,
you, it's like you've always done them first thing in the morning or at night. I feel like
mhm.
unless it was like a vacation or
Yeah.
um
I mean,
I
even
f-
going back to, when we were in grad school,
yeah.
we'd be in classes all day, and then I'd go work. I would train people or work at the PT office in the evenings, and then I would go to the gym, until like 11 o'clock at night,
And then you'd
three
probably
days a
come
week.
and then
And
you'd
I and
probably
I
go home and study after that, which
and
is
then
like
I never missed, not during
yeah.
finals week. Like there was, so, it's just like it's always been kind of like you said, in my personality to
Mhm.
to make the time for it, even though, it's not fun dragging yourself into the gym very early in the morning or late in the evening or whatever. But
Mhm.
um, I think it is about kind of your priorities. And like you said, I make the time for training, right, at the maybe uh
Expense of
expense of other things. Like, I think, what did you say last week? Like, you were like, well, what about like watching a movie or something like with me? And I was like, what are you talking about? Like, Like, if I have to train, I have to train. Like, we're
Yeah.
not that's not even like, the thought doesn't even
And
cross
then he gets
my
mad when I
mind.
stay up late reading a book and not hang out with him. So
No, I mean, no, not necessarily that, but, um, that's more about, like, you're tired all the time, so I'm like, "Go to
I
sleep."
know. So that's the other
But
thing. It's like right now I'm like in my book girl era and but anyway. Um no, I mean, listen, you have it is very personality based, I
mhm,
think, and not
yeah,
I think we know.
yeah,
Um and so, I think that you have to go in, and I think we said this at the beginning, it's about managing expectations. Like, if you
mhm,
know personalities, traits are like very hard to change. Um, and habits are hard to change. And I will shout out a book called Atomic Habits. I really like to read it this time of year. Well, we're recording this in December, but this is going to come out in February. Um, but the book Atomic Habits, I actually read it after we had JD because I was like, you have no problem with this. But I was like struggling to even take my thyroid, remember to even take my thyroid medication, you know?
mhm,
And when you're like from a mom perspective or the primary caregiver perspective, when your brain is overloaded with thinking about someone else and everything that they're like totally dependent on you, and you have fatigue and your schedule, like from my perspective, my schedule was completely different every day until our son started sleeping through the night and taking his naps consistently. And then that's only consistent for as long as it's consistent, and then it changes again. Everything changes over and over. Like, we had really good stretches with JD for sleep for a while, and then he started to like night wean potty training himself after Maddie was born. And he was sleeping through the night, and then he decided that he didn't want to pee in his pull up anymore when she was born. So he would just wake up every night and come get us, and some nights he comes and gets us, and other nights he sleeps through the night and wakes up dry, and it's great. But we never know right now, you know? And same thing with Maddie. We never know if she's going to wake up at 11, if she's going to wake up at 1, if she's going to wake up again at 5. Like, it's not determinable at this point. Um and then also my schedule is dependent on you guys getting out in the morning, and calling. I'm like throwing you under the bus here. Not for nothing, but they never get out at the same time every day. So I've had to. Why are you shaking your head?
no, you can continue, but
No, what?
no, no,
Are we gonna
just
get in a
continue,
fight on the podcast?
on the podcast, that's fine if you wanna do that, but I don't think people wanna hear that, but that's fine.
Anyway, it's I mean, no, in all honesty, it's difficult. Sometimes you leave at 8, sometimes you leave at 8:30. A lot of it depends on JD's behavior, what time Maddie wakes up, and with JD, we were more consistent with what time he woke up, but it was also because he was more consistent with sleep, you know? Um, so and then I've got to pump 3 or 4 times a day. So, and it's like fitting in pumping between my meetings or my clients, and it's like I really only have between when the kids leave and when they come home to get my pumping in, to get my work done, to get a shower, and then like, yes, could I get up earlier? Sure, but it's really difficult when you're up 3 or 4 times a night, So, um, anyway, I'm going on a tangent, aren't I?
A little bit.
A little bit. Where I want to go with this now is to talk about some of the clients that you've worked with who have young kids, came to you after having kids for injuries that they experienced that they weren't experiencing before kids, and why those things were happening, and what you had to do to help them continue to train after having kids without getting injured. So you had one client example that we want to bring in is someone who just kept getting hurt and kept hitting plateaus. Um, because he was just trying to run standard programming in a life that's not no longer standard. And then another person who had three very young kids and was dealing with sciatica, but they were running a typical program, playing rugby, doing BJJ, and like a high functioning executive. So tell us a little bit about these clients and what was going on in their programming that needed to change or shift because their life had changed and shifted.
Sure. So, the first example that you raised, so he was a guy who, both of these guys, one was a little bit closer to my age, one was a little bit younger, but like in their 30s, busy professionals, young families. Um, so the first one, he had his first child around the same time as we had ours. So we were kind of going through, I would say, similar experiences, right? Trying to manage work and children and things like that and fitting in his training. And he was someone that, he was training, like he wasn't missing sessions or things like that, but he was frustrated because he basically was experiencing recurrent back tweaks, like he would just get to a certain point, tweak his back, reset himself, build back up, retweak his back. Like he couldn't really get past this plateau that he was at with his like squats and deadlifts and things like that, um and when I first started working with him, he was running what I would call like pretty standard, starting strength style programming, right? A lot of the people that come to us or find us online are people that are interested in starting strength or have some familiarity with it, right? So um so he was running kind of like intermediate style programming from like practical programming for strength training, right? Which is, 3 days a week, um, full body type programs. A lot of the exercises involve like sets across and things like that. And again, those programs work great for a lot of people if their circumstances allow them to, productively train and recover from that training, right? So one of the first things that I did with him was reduce his training volume. So we basically moved from like sets across to top sets and back offs. And, he was very hesitant at first. If you remember, he had lots of
Oh
questions
gosh,
for me.
yeah. That
He
was
he had lots of questions, and I I don't mind that at all because it shows that they're like engaged and kind of
Mhm.
they want to learn. Um, because he just felt like, well, if I'm doing less, like there's no way I'm going to make progress, and a lot of people have that. A lot of people that come to us have that kind of mentality, right? That
Mhm.
like more is always better, but everybody, again, getting back to like individual differences, people's circumstances are different, and like the training that's appropriate for you is training that you can recover from to make progress. You know what I mean? So for him, I said, listen, just trust me, like give this a little bit of time and like let's see what happens. And I think he was like kind of shocked that his lifts started moving again and he felt better. And we worked together for, I would say about a year or so. Um, where he made very consistent progress. He did not have any back tweaks anymore, and it was really just from taking what he was already doing and making some small changes to it
Mhm.
to allow him to recover better. um and the other thing was, and this happens to a lot of people, is they hit plateaus and they just kind of like they don't really change anything other than like deloading and then working back up, right? So
Mhm.
I'm really never a fan of that unless you're doing that because of like an injury or something. But usually I'll just modify like the rep range or something to allow you to continue to put weight on
Mhm.
the bar for a longer period of time before then maybe you cycle back. But like you're you're manipulating different things in the program other than just like staying at the I have to do sets of 5,
Mhm.
I have to do sets across, like, and you just keep getting to the same point where you get stuck. So I made little tweaks like when he would get to the point where he would previously hit a plateau that allowed him to continue to progress. But I think the biggest thing was really just reducing the excuse me, the training volume so that he was doing more like top sets and back offs. Ascending sets is another thing that I use a lot with people,
Mhm.
um, as opposed to sets across when, they have busy schedules and I know that their recovery is not going to be kind of optimal. So he
How
did.
many days a week was he training?
I had him training 3 days per week.
And what was he
Um,
doing before?
I think he was training 3 days per week as
Okay.
well, but he was doing like full body. So what I had moved him towards after a little bit of time working together was more like a 4-day split. But
Mhm.
what I do
Spread
for
over.
Right, but what I
Yeah.
do for a lot of people is a 4-day split, only training 3 days a week. So it'd be like lower, upper, lower, and then upper, lower, upper. And that's another little tweak that I've done for a lot of people, in that sort of similar situation that's worked very well. So just kind of spreading the stress out a little bit more,
Mhm.
seems to work well for people.
Yep. And we'll talk more about training strategies in the next episode, or
Hmm.
programming strategies.
Hmm.
So, let's talk a little bit about the client that was dealing with sciatica and
Hmm.
um doing so that client that we were just talking about, he was only barbell training, right? Was he
Right.
doing
Yeah.
anything
No,
outside of training?
no, he was strictly a barbell training client. Yeah, for
Okay.
sure.
And then we have people who love to do extracurriculars to barbell training. And but I mean that's not a problem, and we think that it's great when people have other hobbies or physical activity that they like to do outside of barbell training, but it's a that could be a whole other episode in and of itself. We do have an article on like balancing cardio with um strength training, but so we're never going to tell you not to do something that you love or that you want to do. But if you're experiencing pain, injury, plateau in training, or something that's frustrating you, we have to modify something to to not feel that way. So tell us a little bit about this person, what they were experiencing.
Sure. And yeah, I would just to agree with you on that. I mean, a lot of people that are involved in other outside activities, right? They play a sport recreationally or whatever, or they're into endurance training. Like that's all great, but like you have to realize that that stuff has an impact on your recovery too, right? And you're going to have to modify your training to facilitate recovery, and be able to make progress ultimately. So this is a guy, um you know had a young family, just had recently had his third child. So he had three kids that were like all around, let's say 5 and under, right? So maybe like 5, like 2, and a newborn. He was a successful guy, in terms of his career. Definitely was like a high achiever. So he was strength training, and doing jujitsu like 3 nights a week, I would say. Also played rugby, but that was like a seasonal thing, so different times of the year. And it was really with rugby that like realized he had a problem. So he was having really bad sciatica that he had thought was like a hamstring injury, right? So he thought that he hurt his hamstring playing rugby, when in reality it was coming from his back. And um, I think that he did have an MRI before he started working with me that was, showed a, lower lumbar, classic kind of herniated disc and that sort of thing. And, um, so he had already said like he stopped the rugby, but he was very interested in obviously continuing to train and getting back to jujitsu. At the time when he first started with me, jujitsu was kind of off the table because his symptoms were pretty debilitating. Like he had really bad sciatica. So, um, similar to kind of what we were just talking about, I lowered his training volume. And this is something that we run into with people too that are involved in like other recreational activities, is like they want to follow a strength training program that's really geared towards a lifter, right? So,
Mhm.
and when I say a lifter, I mean somebody that like
It's their
they're only
primary.
they're
Yeah, they're
only
only doing
lifting,
that.
right?
Yeah.
They're only lifting. So That's like the way that I explained it to him was like, you're an athlete, right? You are involved in these other sports. So, like, the lifting you have to treat like you're an athlete, right? And an in-season athlete, let's say, right? Because you're doing all of this stuff. So like in season, football players or whatever sport you want to use, they don't lift like when they're in the off season, right? When they don't have as much of their sport practice and things like that. And that's kind of the way I try and like explain that to people is like, you can't train like a competitive power lifter while you're also involved in all these other sports that are going to affect your recovery and not expect something to kind of give at some point. um so with him, he was super successful. Again, I used ascending sets with him more so than like the top sets and back offs.
Mhm.
I used the 4-day split, like spread out over, 3 days per week. He made really, really good progress over time, got back to low bar squatting, deadlifting, hitting PRs in his lifts and that sort of thing. And we worked together for several years, um, and to the point where he was really fully back to um, jujitsu, participation, back to lifting without restriction, and really he did great. Um, every
What
once
was what was his, like, what were his time resources and, like, help resources like in his family life?
I mean, that I don't really know all the details on. Other than to say it never seemed to be a problem for him to get his training done. And my impression was he would lift weights early in the morning, usually twice a week, and then he would get one session in on the weekend.
Mhm.
And then he would go to jujitsu a couple nights a week in the evening. So he was
Mhm.
kind of doing like early morning lifting
Right.
and then jujitsu in the evening. Um, but he also had a job where like he traveled a fair amount for work, and he would always give me a heads up, like, hey, I'm going to be traveling, like we need to modify this, and like so he was someone that always made sure he got his training done, and despite the circumstances that he had, um, and he had a couple little flare ups here and there, which is kind of normal when you have those sorts of issues, but it never got anywhere near the point of when he first came to me, and really had a very consistent and prolonged, um, productive period of training. So it was great.
Okay.
Well, I think to summarize, these are both clients that were in similar situations in terms of having young families, right, having busy professional careers, and also wanting to continue to productively train. And the answer for both of them was, modifying their training volume and frequency.
Mhm.
And when we did that in both cases, they made a lot of progress.
Mhm.
So again, what I always go back to is like, is recovery. And
Mhm.
obviously you have to train hard, right? You have to train hard enough to warrant, you know, that
Like
you
the
have to
lower fr
recover
yeah,
from.
yeah.
But but um, so many of the people that come to us, at least that in my experience, that have come to me, it's like they're actually doing more than they have to make
Mhm.
progress. You know what I mean? And like scaling back a little bit and just knowing how to make some of those adjustments gets them headed in the right direction again. And
Mhm.
at this time in someone's life, right, when they're not going to be sleeping great, when they don't have a lot of time, like it's the perfect time to, you know,
See,
make those sorts of
and
adjustments. And
also to see how much progress you can make doing, like, the least amount possible, you
yeah,
know,
I
because
mean,
I think
I wrote an article for startingstrength.com about my first year of training after JD was born. And I was, I honestly was surprised at the progress that I was able to make on such a low volume program. You know what I mean?
Mhm.
So yeah, I think a lot of people would be surprised because, so much of the trend that we see on social media and stuff like that is all about volume, volume, volume. And, not
Maximum recoverable volume.
right, and it's
Like,
not to say that that approach might not work great for certain people. in certain situations, but like, you have to take the context
Minimal.
of your
Yeah.
situation
And
into
I think
account.
that, one, habits are really important.
Hmm.
Like we talked about in the beginning, but really from like a recovery perspective and time perspective with your family, it's like, what's the essentials that
Hmm.
you need to do?
Right. Right.
And I think that you used the word a few moments ago, temporary, I think you said, which is true. And I think you know, when we make the decision to have a child, we are recognizing, hopefully, that things are going to change, but it's temporary. The fourth trimester, so those first like 3 or 4 months after the baby's born, when they're acclimating to new life, it's really hard. It's exhausting. But then you start to get into a nice little routine, you're getting a little bit more sleep. um and and things are going to continually change up until that kid is out of your house. Crap, right? Like, we did it again.
Yeah, it's
We
temporary.
added we
It's
added we added 18 more years
only 18 years, or or
No, but
30, depending on your kid.
but as they become more independent, as they are awake more during the day, it becomes a little bit easier. You can start to bring them into the gym with you. Like, JD loves going into the gym with you. He has his own little barbell set. I mean,
Sometimes, yeah.
no, I think you like it less than he likes it.
Oh, yeah,
John hates it.
no, I mean, yes and no. I mean, it's mostly it's not that I don't enjoy, like, I'm happy that he has an interest in coming in there sometimes, but I also worry about his safety in there
Right,
because
right.
he's
But
wild, and
he is.
he can easily hurt himself. So,
But he does love wearing your belt and changing your pleats for you. It's very
hmm,
cute.
yeah.
And if you're someone who's really struggling like I am with consistency and scheduling and energy and saving your metabolic resources for like breastfeeding and stuff like that, and mental health, like not going crazy, um it's temporary, and it evens out over time. Why are you laughing?
No, I hope so.
You don't want me to turn into my mother? Is that what you were thinking?
Well, I'm always thinking that on some level, yes, but no, I mean,
Ah,
it's a good perspective to have, and the reason why I'm laughing is because, like you're saying, it's temporary, but we're still obviously in this period
we're
of
in
time,
it
so
still,
it's like,
but it was such
it's like you're reminding yourself that it's
I
temporary.
am reminding myself that it's temporary.
Yeah.
But no, I mean, like, I mean, really, John, I'm giving
Mhm.
you this reminder, like, and myself this reminder, like, just before we got pregnant with Maddie, things were really good. We were in a really good place. JD was about, and that's why I was confident having another baby. Like, up until JD was like 2.5 or 2, I really didn't want to have another baby, because I was like, I can't do this again. But then it got easier. So I think that's the important thing, is to know that it does get easier. And if you're like, for you, John, like, John does not share his what's going on in his head. So I don't really know like how you feel mentally about or like emotionally about all this stuff. But like, I'm the kind of person who is like, John, you're very like, it just is what it is, I'm gonna do it. I don't know really how you feel on the inside about all of it, but I'm very open about how much I struggle with all of this stuff. And like, I just know that this is temporary. Especially the second time around, it's actually been easier for me um to be at ease or at peace with like how little I'm training, because I know when I get out of this breastfeeding phase, I know when Maddie is sleeping more, I know when she's more like doesn't need to be carried everywhere, and she can help put her clothing on, and and she's more active and independent. Like, I will have more energy and time to go into the gym and have productive training sessions. And like my best year in business was the year before we got pregnant with Maddie, and that was because I had the time and resources back,
Mm.
and while I wasn't at my peak competitively again, I was still training consistently. I did, I mean, yeah. So I think just, as a reminder, this is temporary, and we can say that the second time
Mhm.
around. When you're in it the first time around, it does not feel that way sometimes. But in any event, let's wrap up this episode so that we can move on to the next episodes. If you want to get in touch with us, we can be found on Instagram. John, is it John Petrizzo or just John Petrizzo? What is it?
That's a good question,
I'll
Rory.
check. I
I
don't
don't
even know
know. I
anymore.
don't know.
I mean, he's on there because he sends me reels every day.
Not as many as you
Not as
send
many as
me.
you, but
Oh my
I'm
god.
breastfeeding all the time. So when I'm breastfeeding, I'm like, and
But
I'm up
you know
all
what?
night.
I actually, as a courtesy, I do try and watch the reels that you send me, unlike you, who doesn't even look at the things that I
Well,
take the time to
because
send you.
uh,
Hilarious things, hilarious things.
anyway, it's just John Petrizzo. There's no dot or underscore or anything.
Okay.
JohnPetrizzo. That's the Instagram handle. Mine is Rory Megan, RORIMEGAN underscore PRS. You can also join us in our Facebook group, The Secret Society of Barbell Mastery. We do free form checks, Q&As, podcast recordings in there sometimes, live podcast recordings if you want to ever join us live. What else? Our website, Progressive Rehab and Strength. Oh, we do have, so one thing to mention is, keeping track of your recovery and training. So we have something called the Sustainable Training Builder, which is the exact spreadsheet system that we use with our clients that helps us really track someone's response to training, and you can see factors in their performance um, that affect or are affected by recovery. So we can really see and monitor how well someone's recovering and make those changes in their program based on how they're doing. So I'll link an article on training fatigue and on a link to our sustainable training builder. We have a free version. You just want to check it out. And then if you want all the bells and whistles to track recovery and make appropriate modifications that really are consistent with where your life is at now, you can purchase the sustainable training builder for individual or commercial use with clients and stuff like that. So I'll link all of those in the the episode's show notes. That all said, we will see you in the next episode. Bye for now.